And in fact, it is a quite safe place. We should not get afraid. Patient becoming sick is an emotional issue for the patients and family both.
Once a patient is admitted to the ICU or is on a ventilator, the chances of his survival are very less.
It is for saving the life, not taking the life of the person.
Welcome to the program, Doctor.
Thank you.
So, Doctor, the three-letter abbreviation that is ICU has itself given a fear in the society. So, to begin with, could you explain to us what exactly do we mean by ICU care?
I think you kept in a correct perspective. A lot of people have the fear when we tell about ICU. The ICU itself tells about intensive care unit. The intensive means which patient requires an regular monitoring in the terms of their vitals are there for the patient. Patient requires an intense treatment, intense monitoring in the terms of the medical professionals, evaluation, investigations, and that is a monitor intensive care unit. That is called as an ICU. And in fact, it is a quite safe place. We should not get afraid. Previously, I think the thought process was there for the people at the end of things when the patient having multiple complications and problems, patient shifted to the ICU. I think because of that, the misconception is in the general public regarding the intensive care unit. But in the modern days, the intensive care units become much safer and the outcomes are much better. If we are appropriately find out the patient which are becoming sick, shifted early to the intensive care unit, we do an appropriate monitoring for the patient and patient showing significantly better outcomes in the present day.
And also, Doctor, when we think about ICU, we tend to imagine millions of tubes getting reattached to billions of wire which are going inside and outside of a patient. So would you like to explain this phenomenon to us?
When the patients are coming to the ICU, patient requires continuous monitoring. The monitoring in the terms of their vitals, what is their pulse rate, what is their blood pressure, what is their saturations for the patient, what is their urine output for the patient. For that, to have continuous monitoring for the patient is very important, because idea is there whenever the patient becoming sick, the window of opportunity is very small. If that window opportunity are able to pick up early, then we have to do intervention early for the patient. The reason patient requires multiple lines and the connections for the patient. Now, going to the next extent for the patient in the intensive care unit, those patients are unconscious, not able to swallow, not able to take the feeds properly. Those patients requires continuous monitoring about their pressures. They may be requiring the continuous medications for maintaining the blood pressures. They may be requiring invasive lines, that is called as invasive blood pressure monitoring. And those patients unconscious requiring a feeding tube or giving feeding for the patient. At the same time, vital important about is called as how the heart functioning is nothing but how much the urine output will tell about the function of the heart.
I think absolutely, because infection control plays a crucial part in treating life-threatening conditions. And also, there is another common complaint that we hear from patient or be it patient's family about the visiting hours being restricted. So how would you like to address this concern for us?
I think when the patient becoming sick is an emotional issue for the patients and family both. Both wanted to meet each other. But you have to understand, you becoming sick because of some medical problems where medical attention required more for the patient in the intensive care unit. Now, some of the patients, they are having infections because of the infection spread to the others, or the patients are, their fighting power is less, is called as immunocompromised. The outside patients will give the infection for the patient. The reason the visiting hours has to be restricted, that is one. Number two, when the patient is sick, it requires continuously procedures for the patient. Maybe regular the feeding for the patient, regular position change, mouth care, nursing care for the patient, bowel and bladder care for the patient, regularly changing the dressings for the patient. If the patients are visiting, we cannot do all things at appropriate time for the patient, because time is utmost important in the intensive care unit. Everything has to be done care of for the patient from time to time, then only the outcomes are better.
There is also a common perception that once a patient is admitted to the ICU or is on a ventilator, the chances of his survival are very less. So do you think that's true?
I think you hit the nail. That is the most common thing, misconception in the general public. People think that once the patient on ventilator, is end of the story. It is not correct. Ventilator kept because of the various reasons for the patient. It is for saving the life, not taking the life of the person. I think that you should understand. When the patient is becoming sick, if he is not able to perform his own breathing, because of whatever the reason is there, ventilator is to support, relieve his suffering, relieve his the signs and symptoms of respiratory distress. For that purpose, the ventilator is there. Now, the ventilator of two types. One is called as non-invasive ventilator. We are putting only the outside mask. And invasive ventilator, we are putting the tube, the throat, and we are keeping on ventilator for the patient. The ventilator kept in the intensive unit because of the various reasons. One, the patient keeping, if patient undergoing for some procedure or surgery, we are keeping on ventilator. If the patient having pneumonia or patient having some other problems, not able to control on his own, as a support you are keeping on ventilator. And once the patient shows signs of recovery, that is the time we are weaning up the ventilator. So that we can say in nutshell, it is a bridge for the recovery for the patient from sickness. The reason we are giving a ventilator support for the patient, it is not for taking the life of the patient. Remember one thing, whatever the medical intervention has been done for saving the life of the patient, not taking the life.
So, doctor, there's also a perception that ICU care is primarily about technology and machines, and there is less interaction or there is less human interaction between the doctor and the patient. So, what do you have to say about this? Do you think that's right?
I think in the present day, machinery and 21st century with so much of thing is there, I think partly is true. I cannot deny that point is not true. But try to understand, we have the various peoples, the people are there in the intensive unit who takes care of the patient. If the patient is conscious, definitely as a doctors in the rounds, we go and talk to them. Same thing will be done by the nursing staff. Same thing will be done by the dietitians. They'll ask what you like for the food, what you want to have the food today. The same way for the people of a respiratory therapist, physiotherapist. I think everybody comes and tries to interact for the patient. But the expectation of the patient is something different. Here we are concentrating about the patient clinical condition. In the terms of that, we have the communication with the patient, not about anything else.
And doctor, most of us think that once a patient is admitted to the ICU, it's inevitable for the patient to undergo many procedures or interventions. How would you like to respond to this?
See, the thing is that as science has evolved over a period of years, things have changed. Previously, only by seeing the patient, checking the non-invasive monitoring, most of the things have been done for the patient. But as we are having more and more understanding about details about the disease process, their pathology is there for the patient, we are behind getting to the root cause why the patient having the problem. Once the people always tell, unless until treat the root cause what is leading to this problem, patient not going to improve. In the same way, unless until we do tissue diagnosis for the patient, we will not know what exactly the process going on.
So thank you, Dr. Madhusudhan, for interacting with us and clearing many myths surrounding this topic. So before we wrap this episode, is there any message that you would like to share with the audience out there?
Just wanted to share about the message. The ICU is your friend for helping you to come out of your crisis of the medical issues and problems. And in the intensive care unit, we'll get a maximum benefit for the patient, what we can do, than causing the harm for the patient. So that don't think intensive care unit is a quite the space where the end of the life is going to happen. More of the life saved than taking the life of the patient. And whatever the interventions is done in the best interest of the patient is more important what required for the patient. And when it is not required for the patient intensive care unit, definitely we shift the patient out of the intensive care unit to the step down unit or to the general ward also.
So this brings us to the end of this episode. Hope this episode was informative on the topic ICU care, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.